Good day, everybody. Let me welcome my two guests, Jeff Fortson, who is a prostate cancer survivor and was diagnosed a year ago at the age of 42. Is now cancer-free, and he is one of the leading advocates for African American men in particular to learn more about prostate cancer. And also with him is Jerry Bembry. Is that how you pronounce it, Jerry?
That is correct, Joe.
And is a prostate cancer survivor. You actually have three survivors with you today, folks, because I am a prostate cancer survivor. Diagnosed. Now, let me tell you how I found out about mine, guys. I'm thinking about getting a new insurance policy, right? So they have to do, the test, the blood test, and they said, well, it's high. Go to your urologist, get it checked out. If he comes back with a lower score, then, no problem. You get the insurance. The urologist says, yeah, it is kind of high. We ought to do a biopsy. Sure enough, they found that there was prostate cancer there, caught it early. Then it was a question of what type of treatment. So I'm in the talk show business, so I have access to a lot of doctors, a lot of people, a lot of advocates like yourself, and I decide to go with the proton treatment. And I went ahead and did my show from out at Loma Linda. We did our show even while I was going through treatment. Now let me ask you, start with Jerry. Jerry, what's the root of your story? How did you find out?
Joe, there was a span between 2009 and 2011 where I did not have a PSA. I missed 1 year doing a PSA. And in 2010, my brother died of prostate cancer, my older brother.
How old was your brother? How old was your brother?
He was 66 years old.
Okay.
So he was a little older, and it didn't register with me at the time. And then the following year, my brother-in-law got diagnosed with prostate cancer. So I just figured it was hitting a little bit too close to home at that point. And I had missed a year with the PSA, and I went in, and my PSA had doubled. It had more than doubled. And, we all know that doubling rates are very critical with prostate cancer. And I went in for a biopsy, and sure enough, at the age of 49, I was diagnosed with prostate cancer, just completely caught off guard and completely shocked.
Now, were you getting your PSA every year prior to that?
I was doing my PSA every year since the age of 44, and I missed the 1 year. And the 1 year that I missed, that's when it doubled.
Wow.
So it happened in a short period of time. And again, even when my brother died of prostate cancer, it didn't register because he was 66. I knew he was a little older.
Older, right.
And I was 49, and I figured it's not going to affect me at all. And, when I was diagnosed, I found out that I had two uncles that died of prostate cancer. And then, when you start doing the research, you realize that when you have family members that have prostate cancer, the chances of you having it increase as well.
Now, Jeff Fortson, you were diagnosed a year ago at the age of 42. How did you find out?
Actually, good question. Good morning. How are you doing?
I'm fine, Jeff.
Good. So, correct. At the age of 42, I was diagnosed. And actually, my story is a little different. For the past 10 or 11 years or so, I've been experiencing prostate concerns, swollen prostate. So I've been on a number of different medications off and on. And around last year, it got really serious where I was having a lot of pain. So I went in to get a PSA done to check and see what was going on with me. And at the time, my doctor mentioned that I had blood in the urine, which I couldn't see at the time. And he said that I need to be scheduled for a biopsy. So shortly after being scheduled for a biopsy, found out that I was actually in the first stage of prostate cancer.
And let me ask both of you in terms of, and I'll start with you, Jeff, on this. So what is your recommendation to men listening here on Urban View, and particularly to African-American men, but not exclusively, because there's a lot of misinformation. Should I wait until I'm 50? Should I, that type of thing? Do I need to worry if I'm in my 20s or my 30s? Jeff, what's your advice? What are you advocating?
Actually, what I advocate, along with my doctor who treated me, and she happened to be one of 10 African American females in the United States as a urologist, and she's age 35. And one thing that we kind of came to agreement on is that at age 35, if you have a family history of prostate cancer, and interesting enough, a lot of times we don't even know that we have a family history, just like I didn't find out until after I was diagnosed what was going on both sides of my family tree. So I advocated age 35, start getting screened for prostate cancer if you have a family history. And if you don't have a family history, at age 40, you should begin the screening process, and you should do it annually. And, Joe, actually, there's a number of places throughout America this month, since this is Prostate Cancer Awareness Month, that are also offering free screenings available. So folks can go to pcf.org, look for free screenings, and they could tab into it there, put in their city, state, or zip code, and it should show you a range of places throughout the United States that's actually offering free screenings.
Now, Jerry, we've mentioned here several times PSA. That's your blood testing. There's also the digital test. What, in terms of what you advocate, is it one or the other or both?
Yeah, I think you should do both, and I agree with Jeff. I mean, if you have, especially the family history part, and I wish I had known that I had two uncles who had passed away from prostate cancer, because it would have me more inclined to be on top of things and may not have missed a year. But men have to realize that prostate cancer is the second most common cancer among men and the second leading cause of cancer deaths among men. And then when you're African American male, your chances of getting it are increasing. And when I was diagnosed, it kind of, it hit me hard, but it hit a lot of friends who were my age hard as well. And the first question I began to ask people was, have you had a PSA test? And it was amazing to me how many of my close friends did not have a test. So I think it's important, if I didn't take this test, if I had waited a couple more years with the doubling rate I was experiencing, my outcome might be totally different right now. But, I'm cancer-free and leading a healthy life right now. Yeah. I'm extremely happy about my cause.
Yeah, and what I do. And that same thing here, it was cancer-free, prostate flat. No, of course, the routine. That's the other thing. How do you go about, let me go back to you, Jerry. How did you go about deciding what treatment to get? Because that's the other big question that when I do have discussions with friends or here on the show, inevitably what comes up next is, well, then what treatment should I get? And that's a big question. How did you decide, Jerry?
I live in Baltimore, and I teach at Morgan State University, and so I went to Johns Hopkins Hospital originally, which is the top urology clinic in the country.
Right.
And they gave me the many options of radiation treatment and a radical surgery. And the one key factor to me was when my brother-in-law was diagnosed, he had the surgery, and I saw him about 2 or 3 months after his surgery, and he looked great, he felt great, and this was even before I was diagnosed. And so after I was diagnosed, I remembered that, and I spoke to him about his doctor, and he had a doctor, Dr. Ash Tewari at New York Presbyterian Hospital, New York, who is he's one of the top top men in the world in what he does. He's had about 4,000 surgeries. I wanted someone who was experienced. I wanted someone whose patients had great results. And I went to him, and I tell you, it was one of the best moves I've ever made. The treatment has been wonderful. I mean, the surgery went well. Some of the complications that some people have, I've experienced very few of those. So I'm just really happy with that. And I was getting hit from a lot of different directions.
Yeah,
I had another uncle in Arizona who had the radiation therapy. He suggested that. So my path of surgery, and it went well.
Yeah, I that's the same thing here. I was like, okay, I mean, everything from freezing the prostate to cutting it out to proton to seeding to, robotic. There's just so many. But I always told folks, Jeff, just take your time. If you certainly have time, and that's what my doctor kept saying. You got time, let's 6 months, 7 months. Let's just take your time. We'll keep an eye on it. What was your experience, Jeff?
Actually, my experience was a little similar to Jerry's when I was diagnosed last year around this time frame. Is actually what I did. I kind of did a search throughout the internet looking for information, and I came across Jerry's article that was written with Ebony and on theroot.com, and Jerry actually shared what he had done as far as having a radical prostatectomy. Also, there was another.
That's the removing of the prostate, right?
Exactly.
Okay,
exactly.
go ahead.
And then there was also another young man for Black Enterprise who also had shared his story. But unlike with Jerry, he actually shared it from a medical standpoint. Really didn't go into too many different things as far as how the results were. Jerry was actually candid with his, and as a result of finding out about Jerry, I actually reached out to him. Didn't even know who the brother was. Reached out to him. Told him I was in the process of going through a biopsy. Shortly after going through the biopsy, I was diagnosed. From there, we stayed in touch. Jerry recommended a book for me called Surviving Prostate Cancer by Dr. Patrick Walsh. And real educational guide. It went through all the different aspects of treatment. Gary mentioned to me as far as his selection, what he chose. And I'm here in Georgia, and here in Georgia, it's a big radiation state. Mm-hmm. So as I was being consulted about, or actually given options about my choices, that was one thing that was heavily focused on. But I knew that I was going to take the same path that Jerry did. And the reason was, it's two different things I looked at just because of my age range being 42 at the time.
Right.
I looked at span of life, and I looked at lifestyle. And so depending upon where you are in your age range, I decided surgery was the best option for me, just in case it came back again, because there's about a 30% chance that once you are diagnosed and cured of it, that it will actually reoccur again.
Right.
So I wanted to have an option of actually going from surgery to radiation, which would be a lot easier, just in case that came up, to next option would be possibly chemotherapy. Yeah. So that was the reason. That was my choice of option.
Yeah. See, I at one point in time had considered seeding.
Okay.
The little grain that they say about the size of rice, and they seed, and you go in for radiation. But then you can't, and like you say, you have to look at your lifestyle. You can't be around young children. And I had a grandson that was very young. So that meant he couldn't be around me for a while, which was impossible, because I'm always near him or around him. So that it's those little things that you have to look at. In terms here, let me also ask you this: did you have the same experience I had? And that is that when you do talk about it, men sort of gravitate to you. They want to really talk about it.
Yeah, I don't know. I don't know if men. Yeah, I'll take that. I don't know if people. I had some friends who actually never spoke about it with me.
Really?
And never brought it up and never really acknowledged it. Then I had some really close friends who, were sympathetic. They wanted more information. They wanted me to share my experience. And then some of them actually went and got PSAs and biopsies because they were concerned about their PSA levels. So it kind of fell into two groups. One group of friends who actually got closer to me through the process because they were concerned. And some people, when they hear the word cancer, they kind of like push you aside a little bit, you know what I mean? And they kind of like treat you a different way. And so I had that experience. I had some friends who, to this day, and I still speak with them, who have never mentioned the fact that I've had cancer, even though they know. They've never mentioned or said how you're doing or whatever. So it's kind of odd.
And what about, who was that, Jerry I was talking to? Is this
yes.
Jeff? What about Jeff? What about you, Jeff?
So as far as my experience, seeing that I was 42 at the time when I was diagnosed, there was really no one in my circle who had actually gone through this process before.
Yeah.
And there was actually really nobody in my circle who had cancer. So it was a shock to them, a shock to me. So it was a matter of, as I reached out to a number of brothers and shared what was going on, just like with Jerry, they were encouraged to make sure they were getting their annual prostate exams done, finding out more about PSA, seeing what they could do to minimize the chance of getting the disease. So I became at that point a kind of a personal advocate, even going through my process, fear, and all that involved in the process. So that's what happened. Ironically enough, that like Jerry mentioned, as far as a few friends of his who never said anything about it, I probably had one or two kept their mouths closed about it.
Yeah. See, I'm a little older, and I got to tell you, I never will forget being out when I was out at Loma Linda out in California going through my treatment. I went to a party. As a matter of fact, I can remember it was Derby Day, and it was just this guy gives a